Now, local experts speaking on booster effectiveness against the Omicron variant of the coronavirus. This comes as 16 and 17-year-olds are now eligible for the COVID-19 booster. Now, on your sides, Aaron Jenkins spoke to Biden's director of infectious disease. And Aaron, what are his recommendations tonight?
Angie, it's a repeated phrase, get your vaccination and get your booster, especially since we're seeing an increase in case numbers across the state and here in the East. And as far as the Omicron variant is concerned, Dr. Ryan Gallagher says it's no surprise there is a new variant emerging, but the vaccines were created with this in mind to withstand the virus mutations.
Most experts, including myself, would think that's still going to hold true with whatever variant, because these vaccines induce a particular response by your immune system. That's going to be the case whether it's Omicron or Delta or Alpha, whatever variant or whatever one comes after Omicron.
Pfizer recently announcing their booster vaccine would help fight against the Omicron variant.
We don't really know the effectiveness of the vaccine in terms of a percentage with Omicron, but at the same time, we do know that the principle has held true through many variants, and that is, regardless of the variant, vaccine is your best weapon to blunt the severity of disease.
Dr. Gallagher says the virus is creating variants like Omicron because a large portion of the population is unvaccinated, which is why he says it's important to consider getting your booster and especially the initial doses.
The primary series is much more important than the booster. The boosters do help, but a way that we can knock down the speed at which the virus is mutating is to keep it from spreading, also to decrease the amount of susceptible hosts. And you do that by mask wearing, and you do that by vaccination.
With the percent positivity rate in Biden health system increasing from 5.2% in the middle of November to an 8.2% now, Gallagher says the virus is here to stay for a while.
It's still around, and I think that showed that the testing and the percent positivity should show people to still wear their mask and wash their hands and do all those things that honestly we're probably sick and tired of, but it's just as important now as it ever has been.
Even though kids under the age of 16 aren't eligible for a booster right now, Gallagher urges parents to get their kids the first 2 doses to reduce the number of possible bodies the virus could live and mutate in. In studio, Aaron Jenkins, 9 on your side.
Aaron, thank you.